Hi, so for today's episode of Flourish with Faiza, I have a very special guest. Her name is Dr. Beth Frates. She's faculty at Harvard Medical School as well as Harvard Extension School. She's one of my favorite professors and the one who introduced me to the fabulous world of lifestyle medicine. Welcome, Beth.
Thank you so much, Faiza. I love flourishing with Faiza, and being part of any Faiza activity,
That's good.
event, program is a true honor and delight.
Oh, wow. Thank you so much. So, before we begin with our topic, which is stress and how it affects autoimmune conditions, can you share a few things about yourself and how you got into lifestyle medicine?
Sure. So I was 18 when my father had a heart attack and stroke, which left him paralyzed on the left side. He was 52 years young at that time, and this event certainly had an impact on him, his life, his lifestyle, and also on mine. He did make a full recovery. He did attend Pritikin cardiac rehabilitation program, which changed his lifestyle significantly and allowed him to flourish for 27 years. And he would say those last 27 years were his best 27 years when he was following a healthy lifestyle in terms of how he ate, how he moved, how he handled stress, which was a
Mm.
big factor for him and for many. And the way that he slept, how long that he slept, his social connections, and his ability to avoid risky substances. And that led me to change from an economics major at Harvard College to a pre-med student at Harvard College, then to Stanford Medical School and my internship at Mass General, and then my residency, which was in physical medicine and rehabilitation, to focus in on stroke survivors. It was when I wrote a book about how to prevent a second stroke that I
Mm.
really dove into nutrition,
Okay.
exercise, and stress. And then in 2006, I entered the world of lifestyle medicine and helped the field become a medical specialty with board certification, with a membership in the American College of Lifestyle Medicine with 15,000 members, half physician and half allied health care professionals. That's my story.
That's remarkable. Thank you for sharing it with us. So, a bit, to start with my first question, in your experience working with clients who've had chronic illnesses or autoimmune disorders, how does stress tend to influence their symptoms, coping capacity, and overall well-being? And are they aware of it that the stress is causing it?
Mm. I love the focus on the pillar of stress. I think it is paramount. And when I was 18 and I was thinking about my own dad and his intense work hours, the stress he had at work to make sure that the company his father started could be a productive and successful company for his generation, the second generation of PEGs. And that stress was manifested in many, many ways that I saw with my own two eyes.
Mm.
So for me, since 18, so that would be 40 years, I really have been focused in on stress. Back
Okay.
in 1980s, when my dad had his heart attack and stroke, there was something called type A behavior, and there was the hostility factor, which was
Mm.
greatly related to stress and how we manage stress. And now in 2026, it's very interesting to see. Of course, the American College of Lifestyle Medicine has a pillar devoted specifically to stress management and stress resiliency. And I will share with you that the Essential Eight of the American Heart Association does not include stress, but their critical nine, which is less well known, includes something they call psychological well-being. The American Heart Association, our major medical body
Mhm.
working to reduce chronic condition of heart disease, which is our number one killer. In that critical nine, they do talk about stress and stress management, as well as social connection, actually. So
Mm.
it is something that I always wanted to prioritize, But even myself in 2006, when entering this area of lifestyle medicine, health and wellness coaching in 2008, it wasn't until 2 or 3 years into working with people,
Yeah.
working with patients, that I realized stress is the critical pillar to address before the stress reaches a peak and a
Mm-hmm.
level which paralyzes people. So, to answer your question, stress has an enormous impact on chronic conditions, the development, the
Okay.
progression, and it is through IL-6. It is through multiple pro-inflammatory cytokines, molecules that we know impact the development and progression of these chronic conditions and autoimmune diseases. So we in 2026 have the biology behind how stress changes our molecular system, our biochemistry. Now, to the awareness of the patient, I
Yeah.
believe most people were unaware. In fact, it was Herb Benson with his Mind Body Institute back in the 80s and 90s that helped clinicians in Boston and Harvard faculty to appreciate stress and thus share this information with patients.
Mm.
But I will tell you that a lot of patients don't see the connection, even today in 2026. 2 decades ago, when I first
Mm-hmm.
started, certainly they didn't fully connect it. And the evidence was not quite as clear to show all the journal articles and the data to patients and colleagues. It's clear now. But even now in 2026, some people do not see it. And it takes health coaching and open ended questions such as, how do
Mm.
you feel that event impacted you? And it would be a stressful event. So the loss of a job, moving, the loss of a loved one. How did that impact you? Open ended question. They can answer it in multiple ways. And then eventually, though, when you get there, they will say, I started to sleep less.
Okay.
I started to eat foods that I didn't normally eat, that I had
Mm-hmm.
eaten in my past that were comfort foods for me. I had some trouble with my relationships, my
Right.
communications,
Mm-hmm.
because I felt so much stress. And I noticed that my symptoms, whatever it may be, were
Yes.
getting worse. So
Mm-hmm.
they may not come up with this even in
Right.
2026 right away, although I'll say in 2 decades working with people, stress comes up more readily now,
Yeah.
but it is still not fully appreciated.
No, I share my experience with you because when I decided on doing, working on this research, my entire pre-capstone was about researching that, the in literature review and everything, and it was proven from it. But if you talk to regular people who've been living with autoimmunes for so long, and they were like, you know what, maybe minor effect, but to that level, and it's difficult to convince someone when they're not fully aware of it that lifestyle changes would positively affect you so much. And that's what my project is all about, to create this awareness, primarily to at least do that. So moving on, what therapeutic practices as a coach do you recommend if you see that stress is exacerbating somebody's symptoms? What tools do you suggest personally?
Mhm. There are so many evidence-based stress
Mm-hmm.
reduction techniques. In fact, when I give presentations on lifestyle medicine in general, when I am doing a general presentation and I just talk about the pillars, for stress, I talk about 14 evidence-based options people have, from exercise, forest bathing, listening to music, any kind of music they enjoy, yoga, laughing, meditation, mindfulness-based stress reduction. Something as simple as chewing gum. Mind you, you need to know what's inside the
Yes, yes.
gum and the
Mhm.
ingredients, but as simple as that,
Mm.
to something much more complicated, which is managing your inbox, which
Right.
is your email and your workflow, trying to
Mm.
get a hold of that. And
Mm.
also taking vacation, making sure that you're able to unplug will really help you reduce your stress levels throughout the year. If you're able to look forward to
Able
that
to.
vacation, really
Mm.
relax in that vacation, connect with loved ones in that vacation, and then petting your cat or dog, releasing oxytocin, playing
Mm.
with your cat or dog, hugging your friends, talking with your friends, communicating on a deep level with your friends. There are so many ways that are evidence based to
Right.
reduce your stress levels that I myself ask people as a coach
Mm.
an open ended question.
Right.
What do you find lowers your stress levels?
Mm.
And I let them tell me. And then I say, what have you tried in the past
Right.
that has worked? What have you tried in the past that has not worked?
Mm. So it is an active process. That's the thing about it, that reducing stress and keeping stress free is keeping stress free is a process. It just doesn't come immediately. So that's what, I am hearing from you, and that it's a constant lifestyle.
Exactly. It also takes into consideration where the person is in their stage of change, the transtheoretical model of change. I think we all have a journey with this pillar of stress management. I did not really focus on it even for myself, even though I was a go, go, go getter and someone who probably carried internally a lot of the stress, but didn't
Mm.
express any of it, just kept it inside for many, many years until I became a parent and there were extra stressors, beautiful responsibilities, but also stressors. And then for the first time in my life, I took yoga classes and I was older.
Okay.
I was a
Mhm.
mom at this point, so in my late 20s. And that yoga experience changed my life. Then a decade later, when I was managing sandwich generation, caring for my mom after my
Right.
dad passed away and caring for teenagers, that I embarked on mindfulness-based stress
Mm.
reduction with John Kabat-Zinn at UMass Worcester. His group held a
Okay.
5-day CME on it, and it changed my life. That was a decade ago.
Wow.
So I had myself two very important and powerful experiences with yoga and MBSR
Mm.
that helped me to better communicate to patients how much these interventions can impact a life. When you talk from a place of authenticity, and this is something I learned in 1999 when I was a resident and I studied exercise habits of healthcare professionals and their counseling strategies, and found there was a one-to-one correlation. Those physicians that
Mm.
exercised counseled on it. If they strength trained, they counseled on it. If they did aerobic training, they counseled on it. If they didn't do strength training, they didn't counsel on it. So this brings
Okay.
this whole concept back to, if you are the provider, the
Right.
practitioner, the clinician, the coach, the mental health therapist, the physician, and you have experience with these stress resiliency techniques,
Hmm.
then you are more likely to counsel on them. You're more likely to be motivating, inspirational, believable, because you're sharing your authentic
Right.
experience with
Absolutely.
them.
Now, I love this because for autoimmune, a lot of disorders are sort of invisible. And when you talk to people, they feel, you would never know what I'm going through. Or how would you know what would help me? But if somebody's been through it, that's why, one of those circles that we were talking in, as like social connection is so important, because you can say, you know what, I don't exactly know what you have because there's such a huge variety of autoimmune illnesses, but there are some commonalities, and at least I have something. I mean, there's some connection point. um, let's move on. And one final question that I have is that, would you suggest some sort of a structured program for someone who was looking for, getting better control of their autoimmune symptoms. Because that's what I feel is lacking, and that's how I embarked on this project. Because there are breathing techniques, there's this happening, that happening, but I could not find one resource where you say, you know what, I have an autoimmune illness, and where can I go where it would show me all the choices. So there's a workshop that I'm conducting this weekend, and it's in hopes that we would be able to do something like that. But what would you suggest?
Yes. So for a program that's going to have the goal of enhancing health, well-being, encouraging flourishing in people who are managing chronic conditions like autoimmune diseases, it must be enjoyable. It must be fun.
Mm-hmm.
How can we ensure that will be? I believe that it will need to have a variety of options such that the person who is engaging with the program can select what they feel they need.
Okay.
Now, I'm a lifestyle medicine expert and person who believes in all six pillars, so I would recommend that there's a menu,
Okay.
and one would be physical activity. Where do they find joy in moving their body and how? And
Mm-hmm.
then it needs to have a component of nutrition. We all must nourish our bodies and cells every day. So we do want to have some information about an anti-inflammatory eating pattern.
Yes.
Then sleep is extremely difficult for people who have stress. So prioritizing sleep so that we can set up an environment where people can get as much sleep as they possibly can, because we know that when people are sleep deprived, they're more likely to experience stress. But of course,
Mm-hmm.
stress impairs the sleep. So we need to know that these two are really working in concert together. So
Okay.
I think having some information, some sessions on sleep would be powerful. Then this connection to risky substances must be identified and called
Yeah.
out in a non-judgmental way.
Mm-hmm.
I was just reading an article even today where they are connecting a direct pathway between
Okay.
alcohol and stress
Mhm.
response. So being very open and having that risky
Yeah.
substance use option for learning more, for digging deeper into the connection between risky substances and stress really needs to be part of it in a non-judgmental way, just a factual way that
Yeah.
we know when people are experiencing a great deal of stress, many gravitate to smoking, drinking,
Yes. Mm-hmm.
opiates, other risky substances, because that can really sabotage any efforts. And if it's not openly expressed, I
Yeah.
fear that it will be a shame, blame, guilt situation where the
Mm-hmm.
person participating in your program won't even want to bring it up. But if it's in the menu,
Yes.
then
No,
we're
I love this. I really, really like this idea that there's a menu. There is a choice to some extent, but whatever is, prohibited, that should be said that, listen, if you're part of this you would have to leave. Um, yes, I think this was very useful, very beneficial. Thank you so much for being here. And until next time,
thank
take
you.
care. Bye.